The American Red Cross has issued an emergency plea for blood donations. The organization is facing a severe blood shortage.
Right now we're facing an emergency shortage.
We're at an urgent level of needing blood, actually.
A local blood center needs your help saving lives. There is less than a one-day supply of most blood types at Memorial Blood Centers.
During the COVID-19 pandemic, the nation experienced some of its worst blood shortages in over a decade. Walla Walla, Washington was no exception. In October of 2021, Walla Walla's local newspaper, the Union Bulletin, reported on the severe shortage of blood in the Northwest, citing that the American Red Cross has put out an emergency call for blood donations. Emergency shortages like these are becoming more and more common, yet the percentage of people who donate remains incredibly small. The American Blood Center estimates that only 3% of eligible donors give blood each year. Why does that matter?
Blood is an incredibly important thing. It's one of the things that we can't make. It has to come from somebody to go to somebody.
Blood is one of the few resources that can't be manufactured. Blood helps accident and burn victims, heart surgery and organ transplant patients, and those battling cancer. With blood donations as scarce as they are and shortages across the country, hospitals and collection agencies need all the donations they can get. But what if I told you that the Red Cross and other blood collection agencies have knowingly been turning away healthy donors for years? And who are these missing donors?
My name is Sam Allen. I'm a sophomore student at Whitman College, and I identify as a cis queer man.
So it was name,
your role at Whitman College, and if you feel comfortable, how you identify.
Yes, my name is Christian Wallace Bailey. I am a senior here at Whitman. I'm just finishing up a history major, and I identify as a homosexual man, gay as fuck, as they say. I have never donated blood because I have been ineligible for as long as I've been of age enough to donate blood.
So I have actually never donated blood. I have never been able to donate blood. First time I tried to do a blood donation was in high school. It was at a high school blood drive, and I was not aware of the male-to-male sex rule. And I was sitting in the room in the van, the Red Cross van, reading through the rules, and I got to that part because I was being a very diligent reader, and I thought, oh, that probably is me. I probably can't give blood.
The rule referred to here is a decades-old ban that prohibits blood donations from gay and bisexual men. In the Red Cross's screening survey, the questionnaire asked male donors if they have had sex with another male in the past 3 months. For female donors, it asks if the survey taker has had sex with a bisexual man in the same time span. If the survey taker answers yes, they are prohibited from giving blood. This prompt sits adjacent to questions regarding HIV and AIDS, insinuating something far deeper about the quality of queer blood and exposing a historical stigma tied to gay men and their sex lives, a stigma that dates back to the 1980s.
Family Feud now 5 nights every week.
In the early 1980s, the HIV/AIDS crisis was at its peak in the United States. In the decades before, the queer community was making great strides in achieving equality. The Stonewall riots had marked a turning point in LGBTQ civil rights, and the queer sexual revolution was well underway. Roughly 24 states had decriminalized sodomy by 1980, and some activists were already discussing the possibility of legalized same-sex marriage. The onset of the AIDS crisis, however, exposed that homophobia was still alive and well in government and medical establishments. During this time period, gay men were the first to report cases of HIV. And although they were far from the only ones who contracted the virus, queer AIDS victims were the ones who got the nation's attention. And as a result, they received the brunt of the backlash. Treated as second-class citizens, government entities that were designed to protect their constituents instead turned their backs on the multitudes of men dying from this new, quote-unquote, gay plague.
You know, as long as it was just gay men dying in the cities, it was kind of seen as something that could be ignored, or was that it was in fact good, or it was a God-given punishment onto the gays. And there's the famous fact that Ronald Reagan wouldn't say AIDS for the longest time, even when lots and lots of people were dying from it.
Not only would Reagan not say the word AIDS, his administration and others would critically underfund national AIDS research, resulting in a high death toll for the LGBTQ population. To clarify, to contract HIV, a person must come in contact with a viral load from an HIV-positive person through their bodily fluids, whether that be blood, breast milk, or semen. HIV was not solely limited to the activities of gay and bisexual men. However, wary of the disease spreading outside the LGBTQ population, the FDA intervened. Originally established in 1906, the Food and Drug Administration was created to protect the health of the U.S. public, to ensure the quality of its food, medicine, and cosmetics. In 1983, seeking to protect United States citizens, the FDA established a lifetime ban on blood donations from gay and bisexual men, disregarding the fact that heterosexual individuals could also transmit HIV/AIDS. Flash forward to 2015, and the FDA relaxed its lifetime ban to enable queer men who have been celibate for a whole year to donate blood. In the COVID-19 pandemic, the rules eased up once more, shortening the period of celibacy from 1 year to 3 months.
In the 80s, the AIDS crisis was starting and it was huge and no one really knew what it was, and it just seemed like it was all queer men, gay men, and bisexual men getting it. There was a serious risk of people transmitting it through blood transfusions. There was some sense in like putting a hold on gay and bisexual men donating.
Which, I guess if you really want to boil it down to things, there's some truth to that. You shouldn't donate HIV positive blood, but that's born out of a fear that all gay men are HIV positive, which is not the case.
Having this blood rule on the books kind of perpetuates and continues to perpetuate the idea that queer men are the ones who have HIV. And it also obscures the fact that like straight people can get HIV and do.
In the modern era, queer men aren't the demographic most affected by HIV. In a 2021 report from UNAIDS, an organization dedicated to eradicating AIDS worldwide, women were reported to make up the majority of people globally living with HIV/AIDS.
The treatment of the HIV crisis, the AIDS crisis in the US, is still incredibly homophobic.
It's literally just one of these things that is solely fear-based. We've come so far in terms of scientific knowledge of HIV and AIDS.
We understand what HIV is in a very serious sense that we didn't used to, and we have ways to treat it. But there's no reason to stigmatize gay men specifically for having HIV at this point.
Blood collection organizations like the Red Cross are still obliged to follow FDA guidelines, though many organizations are beginning to acknowledge the absurdity of this queer blood ban. The Red Cross even highlights its opposition to the ban on its public websites.
I shouldn't have to divulge my sexual history in order to know if I'm eligible to donate blood.
I have one thing I want to say to the camera, but I'm not sure if you'll use it, which is, it is not reasonable to ask somebody to be celibate for 3 months in order to donate blood.
Because I've gotten to the point where I'm like counting the days, just thinking about it, and I'm like, what am I doing? You don't ask straight people if they've been celibate for 3 months. Not only are we asking people to inventory their entire sexual history of the past 3 months at least, but also potentially asking people to be celibate if they want to take part in this virtuous act.
And it's a very heteronormative expectation that if you're a queer man, you will go without any sexual contact for the privilege of putting blood from your body into somebody else's for the benefit of an institution that is homophobic and doesn't care about you. You're so welcome.
Public pushback against this ban might just be the key to sway the FDA to reassess its donation policy.
I think it's weird that this issue isn't a more frequent topic of commentary and discussion, and because this is a really weird rule to still have on the books at this point. And I feel like most people my age don't even realize that it's a thing. Even just knowing that this rule existed would have spared me a lot of pain in the situation where I tried to donate blood and wasn't able to. The kind of silence on this, I think, is really hurtful to a lot of young queer men or a lot of people who are trying to donate blood.
And I think a lot of people just aren't aware because it's not something that affects them personally. I can use my power to talk about this because it doesn't only affect me. This is barely something that reaches me. But people who really need blood, really need it, I could be helping with this. Lots of people could be helping with this. Especially in American politics, we like to posture about being woke, about health. And so if we're really gonna put our money where our mouth is, this has to change.
As of December 1st, the FDA announced it will be reviewing its 3-month blood ban rule. If you want to learn more about the ban on queer male blood or take action, please scan the QR code below.